afternoon, colleagues. Do you enjoy your time here? I'm very honored to be here today on behalf of the chair, Sang Yu, and one of the finest conference. Today, what I will talk about is to figure out how to use acupuncture according to Sasang principle. Then, what is Sasang? Sasang Constitution Medicine is uniquely established in the field of Korean medicine. It divides people's physical constitutions into 4 types based on body shape, personalities, symptoms, etc. For the treatment, it mainly offers herbal medicines personalized for each constitutional type. So in that, acupuncture method of Sasang Constitution Medicine gives little explanation on its actual clinical acupoints. Moreover, the vast research and publications about Sasang Constitution Medicine utilize Saam acupuncture to patients with various diseases and disorders. You may have heard about Saam acupuncture in the previous presentations by many good speakers. Anyway, the purpose of this study is to figure out, help establish the acupuncture method of Sasang Constitution Medicine. So we hope this research will contribute clinical application of Sasang Constitution Medicine by scholars, clinicians, and researchers in Korean medicine. So we reviewed about 30 studies, a total of 30 studies about many various Oriental medicine journals and 17 literatures with the keywords with Taeguk acupuncture, Sasang Constitution Acupuncture, A Constitution Acupuncture, and etc. acupoints. This is the flowchart of data selection, and the first section is about Sasang Constitution Acupuncture. One literature says to modulate differences the size of internal organs by Saam acupuncture. Applying acupoints is based on based on the exact diagnosis of 4 constitutions. But its diagnostic method in this time is not a standardized approach. And one literature about Sasang acupuncture uses abdominal palpation in diagnosis of 4 constitutions and selects 5 transporting points based on the theory of intergeneration or interinhibition among the 5 elements. And another literature about Sasang Constitution apply doctors taking pulse, about Chon, Kwan, and Cho to diagnose 4 constitutions in the traditional way of Korean medicine. In the case of insufficiency of any viscera, the standard of that visceral meridian is used for treatment according to 5-element acupuncture. And the second section is about Sasang Constitution Acupuncture versus A Constitution Acupuncture. In the paper about Sasang Constitution Acupuncture and A Constitution Acupuncture, 4 constitutions are diagnosed through doctors feeling pulse between left and right wrists for diagnosis. According to the paper, Sasang Constitution is the only methodological way of typing constitution. And for treatment, Saam acupuncture was applied by supplementing the condition of deficiency or purging the condition of excess. And the third section is about A Constitution Acupuncture. 3 papers about A Constitution Medicine say A Constitutions are uniquely typed through a doctor's feeling pulse on the radial artery of both wrists for diagnosis, because each of 8 constitutions has its own pulse formation. In the previous presentation, Dr. Ko says, in physical terms, humans have constitutional differences in the size of viscera, whether tonifying or sedating of the family or enemy group, is applied to the constitutionally strong and weak relationships of organs, especially by modified Saam acupuncture method. These are 8 different dynamic orders of 12 organs according to constitutions. There's no use of talking about Sasang acupuncture principles this time, I think. A Constitution medicine method is applied in the various studies, especially in musculoskeletal disease. However, applying a Constitution acupuncture to Sasang Constitution has 2 limits. First, the match of viscera vol is based on the theory of 5 elements. The formation as follows: lung, large intestine, heart, small intestine, spleen to stomach, liver, gallbladder, kidney to urinary bladder. And the second, 8 symptoms are differently interpreted with the theory of the symptoms in the book 동의 수세보원. And the 4th section is about 태극 acupuncture. 5 visceral points about 태극 acupuncture. 5 visceral points of heart meridian were applied to full constitutional diagnosis. For example, HT3 for lesser yang, HT4 for greater yin, and HT7 for lesser yin, and HT8 for greater yang. The lesser yang, greater yin, and lesser yin and greater yang are full constitutions, namely Sasang. For treatment, it uses 2 points, 1 point from one meridian and the other point from the other meridian, respectively. Principle of purging of enemy group is applied to the constitutionally strong relationships of organs. While the application method of 태극 acupuncture is easy, its target disease are not various. The point of clinical studies are not various. And there are some questions that whether using acupoints only involved in the heart meridian for diagnosis is right. Also, whether setting the spleen meridian to fire is right is also the limit. And the 5th section is about 5-element acupuncture. 5-element acupuncture, and in the 5-element acupuncture, one literature uses wood points for treating the exhale of the sentiment, and fire point for the escalation, and metal point for the inhale, and water point for the downwards. For ki is biased in a certain direction. And according to one literature, metal point among the 5 elements match for lung group, and earth point for the spleen group, wood point for the liver group, and water point for the kidney group. Fire point regulates all of the 4 groups, since ki in greater yang tends exhalation, and lesser yang tends outwards, and greater yin tends inhalation, and lesser yin tends inwards. And one literature sets metal point for the blood circulation, while earth point for the creation of ki, wood point for creation of blood, and water point for the ki circulation, while set fire point for regulating the integration of mind and body. 5-element acupuncture applied to Sasang Constitution has also limit that the concept of viscera in Sasang Constitution Acupuncture and yin and yang is different. In using 5-element diagnosis, one may not be able to distinguish heart from pericardium. Thus, it is necessary to differentiate the coverage of heart and pericardium in the functional way. these were the efforts for establishing constitutional acupuncture. It has been on the basis of specific and unique physiological or pathological patterns found in each type of constitution. Among studies and literatures chosen, the application of Sasang Acupuncture method was most frequently found. Once the diagnosis is made, the clinician principally selects 4 to 8 points that are located below the elbow and knee joints. This makes Saam acupuncture an especially powerful and convenient, easy tool. Till now, there were few Sasang Constitution acupuncture fulfilling its theoretical and clinical evidence. Further study should be followed to establish proper method of Sasang Constitution acupuncture. The pathology of Sasang Constitution medicine is based on disruptions of the fourfold sacho energizer centers arising from deviations of 성정, which means temper. For instance, the liver to joy, the spleen to anger, the lungs to sorrow, and the kidneys to happiness. It is believed that certain organs are related to emotional activities. So, setting within the framework of a constitution will manage an individual's health, develop the basis of treatment, and prevent disease. But the problem is that the meridian is divided into 3 parts, not 4 parts. The arm or foot, 3 yin and yang, and 6 organs, and so on. Therefore, applying the meridians based on the number 3 to full constitutions of Sasang may be difficult. Thinking about matching 5 elements with full constitutions at the point of mutual engendering of 5 elements might be ambiguous also. Moreover, the mainstream of acupuncture to both clinicians and patients is to apply Saam acupuncture to Sasang Constitution nowadays. I think Saam acupuncture using is mainstream nowadays. So, in order to establish Sasang Constitution acupuncture method, the 2 main concepts need to be considered, which are the consideration of 4 areas, namely lungs, spleen, liver, and kidneys, and upward, downward, loosening, tightening of the ki according to Sasang Constitution, which he says in Korean, 승, 강, 완, 속. For example, Kim's rearranges 5-element acupuncture in the Sasang principle of respiratory system, lung to liver, or digestive system, spleen to kidney. Unlike previous studies that use all their concept of 5 elements or meridians. Also, it uses Sasang principle of differentiating constitutional type and connectively chooses acupoints. Sasang Constitution Medicine contributes to Korean medicine in that it has distinction from TCM. There has been accumulated studies on Sasang herbal medicine, and it's time to add on, especially for providing evidence of Sasang acupuncture. To conclude, we found that studies on Sasang constitutional principles applied acupuncture are divided in 4 categories: Taeguk acupuncture, A-constitution acupuncture, Sasang constitution acupuncture, and etc. We suggest that Sasang constitution acupuncture should be based on Sasang principles under consideration of Sasang constitution medicine's physiology and pathology. We hope that studies on Sasang Constitution acupuncture will be stimulated so that there will appear systemic, organized, and scientific theory of Sasang Constitution acupuncture. Thank you so much.